This is Cerebral Edge, the only show that gives you the edge to be 1% better. I'm Coach Chris, and today my guest, again, is Dr. Grove Higgins. If you don't know who he is, he's been on several episodes before. Look those ones up because they're fantastic. But anyway, Doc is a chiropractic physician in Monument with Neuroathlete. Welcome on.
Thank you very much for having me again. I love this. This is lots of fun, always.
Absolutely. So there's a lot of things going on with chiropractic care and people talk about, right? You know, are they real doctors? Do they hurt people? All this sort of things. Because until recently, I didn't realize that there's a little bit of a pushback sometimes when it comes to seeing a chiropractor. They're like, oh, that's just a bunch of quackery. What is your thoughts on that?
Yeah, so I'll just give you a little bit of background on me. You know, I started seeing a chiropractor back when I was a kid. I jumped off of a play structure from 2 stories up, hurt myself, and that was it. From that point forward, saw chiropractors from time to time just to help me, one, fix the back pain that I gave myself, but then also just to stay up on things, and it just became part of my lifestyle. But I didn't think about becoming a chiropractor until well into my healthcare career. I was working in hospitals doing neurological-based rehabilitation and physical therapy and things like that. Got into athletic training, and then I came across a person that we both know, Dr. Mike Leahy of Active Release fame, who is a chiropractor. But before that, just to kind of give some color to him, he was a fighter pilot in the Air Force after graduating from the Air Force Academy through Vietnam, and he saw dogfighting. Then he was an aeronautics test engineer and test pilot. And then he became a chiropractor, and he applied that knowledge to what he saw in chiropractic, and it made a lot of sense to me. So I pursued it because here's this individual who understands the biomechanics of the body, how to make it work really well. And I started working for him for a couple of years and decided I need to get out of the middleman position. Went to chiropractic school in order to get those tools and that perspective, and have been doing that ever since. But in that time, like you said, learned a lot about the history of chiropractic, which is very colorful.
It's wild.
It is wild. It grew up during a time in the late 1800s when at the same time osteopathy, so the DOs. Grew up at the same time. And they diverged, but before they were very much similar. They were both looking at the human body and looking at how manual therapy can make the human body better, not just in the biomechanics of it, but make the nervous system work better, make the immune system work better, and a lot of other aspects of human performance and function and such. And the osteopaths went down the allopathic route, which is use of medicines and drugs to create changes in the body, and the chiropractors went a different direction, still maintaining the manipulative therapies. And out of those 2 different practices grew some things, different things. One of them, interestingly, is physical therapy grew out of chiropractic. So you had D.D. Palmer, so the colorful founder of chiropractic back in the late 1800s there. And he started out as a magnetic healer.
Magnetic healer.
Back then, a lot of things were being tried. It was all spiritualism, and
you got ghosts in your blood.
This is when you had seances and all that sort of stuff. Yeah, exactly. And he was working late one night. The story goes right where the guy who is cleaning the building that he had his office in was there, and he knew this man was deaf. And he had been working on some stuff with manual therapy and whatnot, didn't really have a clue about the programmatics of it all and all. And this gentleman, he asked him to come in. Well, it turns out this man is deaf. He was a black man, deaf, and he knew him for a long time, had a good relationship with him, and the guy's like, sure, I'll do what you need me to do. And he's palpating his neck and finds that this upper cervical region here is out of alignment, and he asks if he can adjust it, not knowing what that really is and what it's going to do, adjusted that first cervical vertebrae, and the first thing the man said is, I can hear the carriages in the street. Right? Now, just to back that up, I've had that experience happen where I have people say, oh my gosh, I can see better. Oh my gosh, I can hear better. A lot of different things like that. So I can give you my experience that actually does happen. particularly those upper cervical segments. But that's what started D.D. Palmer down the route of putting thoughts behind this and creating this practice. And then to make it more colorful, his son comes along, BJ, who looks at this and goes, well, we need to be very specialized. And BJ only wanted to really focus in on the upper cervical, even though he and his father had developed this whole exercise and manual therapy program. Again, BJ comes in and says, I really want to, I think that everything starts here and ends here, and shoved everything else off. So what he shoved off was the exercise-based therapy, which became physical therapy. So there's that intimate link there. And then going forward, you know, those interesting philosophical backgrounds with, it's hard to test some of this stuff in double-blind placebo studies. Medicine has a tough problem with that, and so there's some distrust in the medical community towards chiropractors and alternative practitioners like that, because if you can't double-blind placebo study some of this stuff, well, it doesn't exist, right? Quote unquote, right? The problem with that is that a lot of medicine is built on the same problem. It's very hard to double-blind placebo study some of what is claimed in medical science, and then is anything that has any kind of positive effect, even if it's for only a small segment of the population, it gets rubber stamped as being beneficial and gets marketed as being medicine, and we use it, and then we find out maybe not as good as we thought it was, and then it gets taken off the shelves.
Right. Yeah, that happens all the time.
All the time. And in chiropractic, you know, we've got different schools. And so this would, again, add some of the color to it. You've got philosophical schools that say, yeah, upper cervical is it. Other people, it's all about the spine. Other people, it's about every joint in the human body. Other people, it's about soft tissue and exercise and such like that. So you have some people who are very straight line, and if it isn't about a joint, it's not chiropractic, and other people who are like looking much broader and trying to be more holistic in their approach. They'd all say they're holistic.
Yeah, everybody says they're holistic, right? Yeah. So, yeah, I've heard that school of thought too. Is they get very focused on just the cervical spine. You adjust that, and everything else gets adjusted. And I've heard that, and I'm just like, that doesn't make a whole lot of sense to me. Yeah,
and there's some amazing things that happen there. Like I told you about vision and hearing and other things like that. And so. But you can get too dogmatic in one thing, and so then people self-select in because they're attracted to that thing, and then when it doesn't work anymore, they go someplace else, and that's who I get to see a lot of. You know, I get a lot of people who have been a lot of places, whether it be medicine, chiropractic, other alternative practices, and not doing so well, and they come to see me, and they're like, "Well, I'll give you a try."
Yeah, I find that a lot with dogma, right? Yeah. In every profession, right? If it's not my way, it isn't going to work.
Yeah, you can get boxed in by good information, but you can get boxed in by it and not see anything else around it, and it limits who you can help.
Yeah. So what is a manipulation? What are you doing when you're doing a manipulation? Like, what's happening in the body?
Yeah. So from a really basic sense, joints can get stuck in any of their range of motion, right? So you can lose some of the range of motion from the joint perspective, right? The soft tissues can get tightened up too, but joints can get stuck in any of their range of motion. But then also the alignment, even if the range of motion is there, the alignment of that joint doesn't necessarily mean it's good. It's like the wheels on your car; they'll still spin even though the alignment's off, right? It just means your gas mileage sucks and your car will drift, right? And you can put new tires on it, but it doesn't fix the problem. You got to fix the alignment, right?
Right.
So same thing with the human body. So the chiropractic adjustment attempts to go in and restore that motion, that proper alignment and that proper motion at those joints. The thought, though, is that input into the system not only fixes the biomechanics of that joint, but then it has a neurological effect because the brain sees that joint and now it can operate better off of it. It takes stress off of the whole system. So the people that are really focused in on just the spine aspect, they talk about subluxation, again, being stuck or being limited in its normal ranges of motion, not disarticulated, not dislocated.
Yeah, that's
right?
what you hear a lot
That's
of.
a different problem entirely, is that those misalignments are going to interrupt the nervous system's ability to run the body properly, and leads to disease and leads to other dysfunctions and at least impeded performance. And the idea is get in there, fix that problem, and let the nervous system do its job better.
Yeah, I mean, we've seen that in the clinic too. At my clinic, working with MedX, like I've had some people that came in, and I said, okay, let's do an isometric test, right? So you get in through and you see how much power output that you can push back with, right?
Yeah.
Particularly in the low back.
Yeah.
So then I had Dr. Wood, do a manipulation on their back, and then also with some ART.
Yeah.
And all of a sudden you test afterwards and you see, the force output just go way high.
Yeah.
And it has, and the only reason that's going to happen is if your brain feels safe enough to make that happen.
Right. You come from a neurological perspective. When I started working in that same clinic, right, back in '99, I had access to those same machines, right? And so I could see the switch, the change from dysfunctional and weak and pain to much more functional, much stronger and no pain, and be able to demonstrate that precisely on a graph, right? That's what convinced me that there was something more than just a subjective, I feel better, right? Which is important, but being able to demonstrate improvements, tangible improvements, is super important, not only for the patient, but for the medical community and the community in general to say, where can I find results? Well, they can come to a clinic like yours, and they can see somebody like me and see demonstrable changes that say, I am getting better, right? It's no longer guessing.
Absolutely. And then with that, you spend a lot of time with your patients, right? You don't just sit there and have them come in and you do, this is the same adjustment for each one, and I'm just going to, crank out as many as I can. Right. You sit down, right? Probably 15 minutes at least with each patient to try to discuss, what their problems are, what their movement is. Now, you also have those people that do that, and they just have people come in and they just ring them out, right? One after another. What's the problems with that?
So again, it's taking a very narrow view, right? And for the most part, the reason that is so successful and so many people are attracted to it is because it fixes 80% of the problems. Fantastic, great. I am so glad that that's there, right? The problem is that this we just need more repetition of the same treatment. Oftentimes bumps up against the fact that we're not seeing progress, and as practitioners of any kind, right? We should say, okay, why haven't we moved that 1% further? Why haven't we moved that 1% further each time, right? And eventually get to this point and say, and be honest with it and say, this is not working. Or it's not something else is in the way. It might be the right therapy, but at the wrong time. It's kind of like picking up a barbell, right? You can take an 80-year-old lady with osteoporosis, and a barbell is going to help her, but it might not be the right tool at the right time. And then when you do apply that tool, you don't stack it. You bring it to her level. You bring the tool to her level, and then eventually it brings her up, right? And the same thing with anything manual therapy, right? You come in to see me, and yes, there's an alignment issue, but if the rest of the system is broken and there's another problem somewhere else in the system, if we don't look at everything and we just keep banging away at that one problem, well, if it doesn't get better in a short amount of time, you probably should be looking elsewhere and look at the whole person rather than the part that you're most comfortable with, right? You're a nerve and muscle guy, right? But sometimes getting that person on Dr. Wood's table and having that adjustment happen makes all the difference in the world, and you can measure the output.
Yep, absolutely.
100%, right? 100%. And you don't have to rrely on the person to say, I'm feeling better.
Yep, I'll just sit there. I've seen him just walk out, and I'm like, you're moving much better.
Yeah.
Your hips are moving much better. I'll put him through a squat, and all of a sudden it's like, yes, that's perfect, right?
Right.
Even with all the nerve stuff that I know, the nerve flossing and different things to get those muscles activated, sometimes they still aren't doing what they should be doing until they get that little bit of an adjustment.
Yeah, most definitely. And you talked about the fact that I spend so much time with patients, and the big part of that for me is that because I come from your world, and I was forced to look here like this, it's hard for me not to anymore. Right. So even though I have these tools that can fix very pointed problems and everything, I still look this way, and I teach anatomy as well. And it's just amazing how the body is so integrated and such. So it helps me keep my vision wide.
Yeah, he does a lot of cadaver studies and anatomy stuff. It's great. If you never had a chance, do you still do that for the cadavers?
I do. It's not as often right now post pandemic, but I'd like to get myself back in there more.
Yeah, that was one of the most eye-opening experiences I had was doing cadaver classes with him. I mean, I did them in college, but when you actually look at the motion and how he explains it, it's fantastic. The other thing that I keep on hearing a lot of is that chiropractors aren't really doctors.
Yeah. So the program that I was in was a 16 semester program that went year round. So we were going. The longest break we had was 2 weeks. And so we were going year round for that amount of time. Part of the reason of that is get it done with so that way you can get out there and pay back your loans. Still working on that. Anyway.
Still working on that, yeah.
But it helps to compress that time. I was lucky I had healthcare experience going in, so I was able to look at a lot of what I was learning retrospectively, but it comes pouring at you and whatnot. So just to give you an idea, we spend a year in just gross anatomy. A year in neuroanatomy, right? A year in microbiology, learning about all the diseases and thinking that as you're learning them, maybe I have that too for a moment. It's funny how the brain plays tricks on you.
You're like I don't think I have ovarian cancer, but now that I saw
right,
that.
exactly. You start reading it and your brain's like, I'm scared of that. Anyway, and so by the time we're done, from a curriculum standpoint, schoolroom, classroom standpoint, we have a lot of the same that an MD does. Where it diverges is what is our experience afterwards. So most of us, will go into preceptorships where we go and we work with a chiropractor or in a hospital where there's chiropractic services. So in Annapolis, we have people in Annapolis. We have people in several from New York Chiropractic College, which is now the Northeastern College of Health. Excuse me. In many hospitals around the whole New York and New Jersey area and places like that. I'm one of the few chiropractors that did surgical rotations, and I spent 1,500 hours in radiology and honing my skills in there. So I'm really blessed there. But by the time we get out, we have this huge breadth of knowledge, but not with the experience that's under testing and exhaustive scrutiny as an MD does.
Yeah, so you go through all that also to know when to refer too, right?
Yeah. Oh, most definitely.
Right.
No, and that's the part that I like about it is I get to interact with the community, and so even though I run into those doctors that are hesitant to work with me, I've learned, because I came from the medical background beforehand, how to work with them, talk with them, and whatnot, and make great relationships with guys and gals that otherwise are not inclined to work with a chiropractor or alternative practice people anywhere.
Yeah, absolutely. And I can attest to how well it does work, because the first time I got introduced to chiropractic care was when I was a wrestler in middle school.
Right.
And I got slammed on the mat by this huge man that I did not think was in my weight class. But apparently you can make some huge jumps in weight classes when you do some water cuts, right? So the next day, or actually that same meet, I was going up against another kid, and I felt like I was a little weak, right? But I shook the hand of the guy, and when you shake the hand, you're like, oh, I've got this guy, no problem.
Or oh crap.
Or oh crap, right? The first one was an oh crap, and I got bam, right? And then the second one, I was like, oh, I've got this guy, no problem. And I went to go shoot. I couldn't do anything. Like my whole body was just like locked up, and I get pinned. I'm just going, what's going on? My coach is like,
nothing's working.
I'm like, nothing can work right now. I don't know what's happening. So the next day, I wake up and I can barely take in a deep breath. You know that pain you got where you're like, right? And it's just like piercing. I can barely move. So my grandparents were like, I'm going to go take you to our chiropractor. And I said, okay. I didn't even know what that was at the time. I was like, sure. What is that, right? So I didn't even know what was going to happen to me, right? All of a sudden he's just like, okay, lay down. He looks at me, takes some x-rays, and bam, adjusts me. And like right after the adjustment, my piercing stabbing went away. I was like, man, I can walk really well. I don't know what's going on right now, but I feel a lot better, thank God,
Right.
So So with my experience of chiropractic care, and of course you've seen me after I've banged myself up within the last few years, right, with my back and stuff like that. And after I get that adjustment, I'm just like, wow, I'm walking a little better. I'm getting stronger again, right? Things are finally feeling like they're turning back online, right?
Yep.
So when it comes to chiropractic care, I mean, I think there are some ones you have to look out for.
Yeah, there's always good practitioners and bad practitioners in every kind of practice, right? Unfortunately, as human beings, we tend to treat things like, we tend to go too far, right? To extremes in a lot of cases. And so, the one big tool that we have, we use that tool often and too much, oftentimes, right? And so you want to find somebody that not only do people say, this is the guy to go see, you really need to see this person for that particular problem, but that can also show you results and is willing to work with you and will listen to you. Because a lot of times, some of the patients that I get, and this is where those bad players come in, they said, I told the chiropractor, don't touch my neck. I'm really scared about my neck, and they adjusted me. I'll never go back to another chiropractor again. And the only reason I'm seeing you is because somebody said I needed to, and I'm here. There's more than one way to skin a cat.
Absolutely.
And if I listen to the patient, we'll find a way. And then oftentimes they'll go and they'll be like, "Can you do that adjusting thing? I think it will help me." Right? And sometimes I get to use one of my tools that I really like using because it is really effective. But I got to work with you and not make you work with my tools only.
Yeah, and you have multiple there. You have exercise therapy, you have, your ART certification, so you have multiple things to help people, which is amazing. But anyway, this has been the Cerebral Edge with Coach Chris. This is Doc Grove Higgins. Look him up at Neuroathlete. Stay strong.